Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's health, the Myohacker Podcast is your guide. Hi, I'm Karindy Ong, a speech-language pathologist, myofunctional therapist, and mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this podcast. Visit myohackerslp.com for free guides and access to my online community and courses. Now, let's dive into today's episode. This question came in on Instagram. You can follow me there at myohackerslp. The question is, my 2.5-year-old has a lot of oral dysfunction. When she speaks, she takes in really sharp, deep breaths every few words, almost like she's gasping for air. She doesn't ever show that she's in any distress or that it is bothering her. Is this an airway issue? And do I start with myo? Love this question. Anytime we see that someone is gasping for air or struggling or looking like it's just effortful to breathe, that's always going to be a good cue that, let's take this to an airway team. Doesn't mean definitively that it is an airway issue, but those are just some cues already that we want to take them in to see an airway-centric dentist, so a dentist that is trained in growth and development, in tethered oral tissues or tongue ties. We want to take them to someone who's going to look at their developmental progress and see, are they delayed or behind in any of the growth of the craniofacial bones? Is there dental crowding? Does it look like they have tethered oral tissues? The reason I say this is because, for one thing, she's gasping and just showing effort for breath, which sometimes when kids are really excited, it can be a pacing issue, and they love that they have started to talk, and this is a concern that they've got all these words, they want to get them out, and they want to talk to everyone, and they don't have time to take a breath. We can see this come up. However, the question is, well, why don't they have that control? Why don't they have that coordination of their breathing and speaking? What is going on that has reduced that? Sometimes it can be a whole posse of siblings and they just want to get a word in between their sisters. Or it can be that we've got some tethered oral tissues like a tongue tie or something that is impairing that free flow of air and articulatory movements, which what that means is we're not getting that freedom of the tongue to move and hit the articulators for speech as easily as we would like. So they are having to work pretty hard to get their speech really to come out clearly, just to be heard. So this is something I would absolutely say, start with a provider who is nearby that specializes in this age group. If you are in a town that has pediatric airway-centric dentists, that's a great place to start. We want to see, all right, do they have enough space between their teeth? Does it look like things are tight in the mouth? You can also start with an OT or an SLP who's trained in feeding as well as tethered oral tissues. You want to find someone that has training in both of those things, because it's going to be a feeding play-based approach when they are under the age of 4. Over the age of 4, that's when we can look for a provider that is specialized in traditional myofunctional therapy. Under the age of 4, we do want it to be approached through a feeding lens, because we're establishing the motor patterns of chewing, eating, swallowing, all of that is pre-feeding, feeding skills. That's where you want to have a provider that specializes in that younger age group. So for this answer, I absolutely reached back out to her directly and let her know, like, yes, please go in and see an airway provider. If you have a dentist, I'd recommend you see the dentist. If you have an SLP or an OT nearby, go ahead and get in with one of them. You don't have to start with both. You can start with one of them. You just want them to be trained in feeding and tethered oral tissues. And this is going to be a way that you can go, all right, is this at play? Sometimes we just need to access the diaphragm. It might be that because of restrictions in the tongue, that can pull on the hyoid and it can pull on the floor of the mouth. It can tighten our whole head and neck and make it harder for us to just be relaxed and breathing. So sometimes it doesn't mean that we need to go in and get a release or do anything invasive. It can just be that we need to train breathing patterns. But this is where you need a professional, and they'll be able to help you with that. So I would say it's fun to start with things like blowing bubbles at home, singing. Singing is such a great therapeutic activity. Building that out for this little one so she can get some of that pacing, and making sure that, again, if there are a lot of siblings at home, that there is time that this little one gets to just talk. And it might be that you set a timer for a couple of minutes. Doesn't have to be very long, but you go, this is your time. I want you to teach me what you're making out there. If you're playing outside, or you tell me, what is it that you are thinking about right now? And it's just, they need to know, like, they have the stage and that it is their time. So we want to help them with their structures, help them with their breathing, but also give them that moment that they feel seen and heard and loved. I have a child in speech therapy for various issues, and their SLP mentioned possible myo issues, including mouth breathing, messy eating, allergies, and maybe a tongue tie. She told me to hold off on getting the tongue tie checked by our dentist and wants to start therapy first. Is that right? Should I just go to the dentist to get the procedure? Such a good question. Given that it sounds like the speech therapist is trained in myofunctional disorders, I would go with that recommendation that we want to start therapy first. However, you can go ahead and schedule the appointment with the dentist. You can see, for one thing, it's not usually like you can get in the same day or even the same week. Sometimes that's the case, but usually it is not. And you might find that you don't even like the first dentist you work with. You might go, that doesn't work for us. So you don't have to get a tongue tie release just because you're making a dentist appointment. So I would say that here, start working with the therapist who, as long as they are trained in myofunctional disorders, they're going to be getting you ready for a tongue tie release if they determine that functionally there is restriction here. And if the surgeon, the dentist, or the ENT determines that, you're still tight, then this is further down the line. What you don't want to hear recommended is, let's jump in, let's do a tongue tie release today. You really don't want to do that, guys, okay? Instead, we want to make sure that the brain recognizes the new tongue movements that we are training. Because if you have had a tongue tie, if you've had a restriction in the mouth, you have learned to compensate with how you speak, how you eat, how you breathe, how you swallow your whole life since you were in utero, since you were a baby. So it takes time and training to get our tongue to move up closer to where we ideally want it, which is up in the palate. And so what we want to achieve in therapy is we get us as close as we can to that target. And then we see, okay, now we're hitting that restriction wall. We're hitting this barrier that we can't get closer to the palate. We can't achieve more movement without incurring strain. That's when we go, all right, we definitely need that release from a functional perspective, because functionally we are limited in our tongue movements. But before we do that, we want to do body work, because fascia, that is the connective tissue in the body, it connects all the way through your toes, up through your ears, through your head, and your tongue. So if we are not working on releasing tension throughout the body, you can get a tongue tie release at midline and your shoulder goes kind of out, or you might have tension in your pelvic floor. You can have things that occur because you didn't actually set the stage for the body to fully release. It's not just that it's releasing the tongue, you're releasing tension that has built up through a pattern of movement for the child's whole life, or for the adult's whole life in the case of an adult. So what we want to do, get a functional evaluation with, in this case, it's a speech therapist who is trained in myofunctional disorders, and the speech therapist recommends they start with therapy. I love that. I would also then ask the speech therapist when we need to consider airway treatment, which that might be a tongue tie release, it might be expansion, It might be a growth appliance. If there's something like that, what dentist do you recommend? Because if they are in the world of myofunctional therapy, I'm sure that speech therapist, they have a team of providers they recommend and that they work alongside pretty regularly. So ask them for their recommendations on dental providers and then a bodywork provider. So that can be a chiropractor, a PT, a massage therapist. There are different providers, and that's where it's so good to have a myofunctional therapist be the lead, the point man on helping you assemble your team to get everybody ready for a tongue tie release and to determine if it's actually even needed. I hope you enjoyed this episode of the Myohacker Podcast. Remember, small changes can have big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review the show wherever you get your podcasts so more people can learn about the show. Head on over to myohackerslp.com for in-depth resources, free guides, and access to my online courses. You can also join the fun on Instagram at myohackerslp for bonus content and updates. And if you have questions or topic suggestions for future episodes, please send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection. Quick disclaimer. The content shared in this podcast is for informational and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult with appropriate professionals regarding your individual circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. We encourage critical thinking and urge listeners to verify any claims or statements made during the show. Your mental and physical well-being are important to us, so please listen responsibly and prioritize your health and safety. Thank you again, and Myohack on.